Kristi Nelson is a television news anchor with an NBC affiliate in Dallas, Texas. She recently donated a kidney to her mother. In a popular multi-part series called Kristi's Gift, her news program examined kidney disease, organ donation, and transplantation from the caring and emotional perspective of a mother and daughter. In this episode of the ASN Kidney News podcast, ASN Executive Director Todd Ibrahim speaks with Kristi Nelson about the emotional and physical aspects of the donation process, how the process can improve, and the need to increase public awareness of the causal relationship between obesity and kidney disease.
So what surprised you most about the transplant process?
I learned a lot in getting ready for it, and I think I was most surprised by how impersonal it all is. As a donor, and as a person who was a potential donor at first, and I sent in my application, and I expected people to call me and explain it all to me and tell me everything I need to know, give me names of people to call, the names of other donors, and that never happened. And it was only because I know that I know who to call, and I knew some people who had done this before, or discovered people who had done it before. But I felt like it was very impersonal up until the week of the transplant. You know, I finally meet the surgeon the day before or 2 days before, and you have to wait to ask all those questions then. And for me, because I put serious thought into this, I felt that there was really nowhere to turn. And I think a lot of the emotions that I had about it could have been abated, or it would have been a lot easier to make a decision faster if there's a little bit more support built into the transplant process, meaning when someone signs up, or if a recipient says, I have a potential living donor, there should be some effort to contact that person. I understand that there's a fear of donors being coerced or being made to feel that they have no choice, but I felt like it was too impersonal.
In terms of abating the fears, is that something that the health professionals, like the surgeon or the nephrologist or nephrology nurses, or is that something that other patients, or a combination of the two? I'm just curious as to how that best would work.
I think first, it would help to get to know the surgeon early on. You know, for example, I think I signed up in June, and my surgery was in August, but in that time, I didn't even know who my surgeon was for weeks, and nobody could tell me. You know, it was sort of it might be this person, it might be this person, and, that's fine, I guess, for a lot of people, but I needed more information, and I felt that was too impersonal. Once I was in the program and I'd gone through all the screening and everything was okay, I did have an advocate, or rather the nurse, the transplant coordinator, the nurse, to ask questions, but there was nothing really before that. So before I had all the screening, I needed some people to talk to, and I didn't have that. No one offered it to me. No one told me how to get it. And that's what I mean by that. So yes, I do think the doctors and nurses should be involved early on, just to make themselves available and to offer suggestions.
You've mentioned the range of emotions, and clearly one of the issues is perhaps the lack of communication and just having the ability to have a better sense of each step of the process and really what was going to happen. I guess beyond that, you've even said you felt honored, you felt scared, and sometimes you were angry about the process. Could you just talk about each of those? I mean, you've mentioned sort of the frustrations. I'm just wondering about the other elements of what it means to donate your kidney.
I love my mother very much, but when I first realized that the transplant was imminent, and of course I'd known shortly before that, a few months, maybe a year before that she actually had kidney disease. So I knew what it was going to come to, and I had already decided in a way that I'm going to have to do something. But when she first told me this, that she was going to have to go on dialysis, and this was before she went on dialysis, and she would need a transplant, I think my immediate response was anger. And a lot of people don't understand that. But here's the thing. My mother has been overweight my entire life. My entire life, I saw her coming home from work and going straight to bed and reading a book. I never saw her take a walk around the block. I never saw her do anything involving exercise, and she never showed any interest in those things. And I knew that she had diabetes and high blood pressure. She took the medications for it, but I never saw her do anything that altered her diet. Her doctors would tell her she needed to lose weight. I never saw her make any real effort toward doing that. So when we get to the point now that she needs a transplant, and yes, I guess she made it many, many years without having to get to this, but at this point, I'm thinking, this is not fair. I've taken care of myself. I've done everything I'm supposed to do, and you've not done anything you're supposed to do, and now here I am. I'm going to have to contemplate having major surgery because you didn't do what you were supposed to do. So that was my immediate thought. I think I really had to deal with that. It was very emotional for me, and I was also, in a way, very sad for her, and it kind of manifested itself into this anger because I was angry she was putting all of us into this situation, and I felt like she was putting me in this situation. So that's how I felt, and I've since learned that lots of people feel that way, so I don't feel so guilty. But, so I had that emotion, and then I felt guilty for having that emotion. I really did. And there's some people you talk to who say, oh, but it's your mother. How can you feel that way? And they just didn't understand what I was saying. That did pass after just a week or two, and I was ready. And I did think about the preemptive transplant. And I thought about it. I wanted to do it. I went with her to appointments. We did all these things. It took so long. Her appointments seemed to be so far in between, and she would need this test, and that would be 2 weeks away, and then she'd need another test. And honestly, time started passing. Then it was just inconvenient. I just wanted it to, things were happening. I had issues with work. I had issues in my life, and I just felt like it was inconvenient, and I just didn't want to do it at that time. So I put it off. And so those were some of the main things that happened. And, I was angry, I put it off, and then I came back to it.
So how do we reconcile individual responsibility and the genetic realities of the world? I mean, how do we balance that?
And do you mean as far as families?
Well, you mentioned we can sort of look at our families and understand genetically what our health is going to look like. And some people are predisposed to hypertension or diabetes or obesity, which are obviously the risk factors for kidney disease. And I'm just wondering, there are things we can obviously do in terms of our diet and exercise, but then there are also people who take responsibility and still have kidney disease or need transplants. I'm just wondering, as a society, sort of observations you would have.
Well, first of all, my mother also had a brother who died of kidney disease, her older brother, and that man's grandson has had 2 transplants. But even with that, there has been no discussion of this in my family. Even with those things, I have never sat at a table and heard anyone talk about any of this. And I don't think people really understand, just what the likelihood of it happening in your family, and they don't understand the risk factors. They don't connect the dots. And just from my very small research in doing these stories, very small and unscientific, it just seemed as though people didn't make the connection. They had heard of kidney disease, but they didn't really know what it was. They kind of think of it as cancer in the sense that it might just appear and there's nothing you can do about it. But I don't think they realize there's a connection and that there are things you can do. There's something missing. And I think so much public education is needed on this issue.
So how have your colleagues reacted when you've come to them with story ideas about kidney disease or just trying to sort of raise their awareness? What's been their reaction?
The reaction has been fantastic. First of all, I had everyone's support in doing these stories, and they were afraid for me because a lot of them didn't really understand it either. This is the first time they've met someone who has been a living donor. A few of us have done stories about different things, but I could say most of the people here probably didn't know anyone who's ever been in this situation. So they were excited, they were very interested, and they were very eager to help me do the stories, and also they wanted me to be okay. So they were behind me 100%. I had another reporter who was sort of the person who did my stories, and she came into the OR with me, and we had a dedicated photographer, and the station formed some alliances with some local groups like the National Kidney Foundation, and I think the Southwest Transplant Alliance. They have some TSAs. I think they are planning some things in the future as far as helping people get kidney cancer screenings, and also as far as signing people up to be organ donors. If you're just getting on the donor registry. So I think those are all things that they have really gotten behind me to do, and they've really pushed me to try to tell my story as best I can, because I wasn't sure I wanted to at first. I thought it was private, and I wasn't sure. But then I decided that so much good could come out of it if I just shared the story.
Now the transplant occurred at Baylor, and somehow you'd mentioned that you were allowed to have a reporter and a photographer there. Mm-hmm. And I'm just wondering how you pulled off the miracle of having a reporter tweet during the surgery. I mean, that's pretty remarkable.
You know what? I actually don't think it was that hard. I told Baylor I was considering this about a year ago, and then, of course, life happened, and I put it off a little bit. But then I called them as soon as I had gone through all the screening and I was approved. I told them, hey, this is going to happen. I need your help. The answer I got back was anything we could do. So a lot of the negotiation as far as getting the photographer into the room and that type of thing, I was not involved in that, but my station was very kind to not let me have to worry about that. They dealt with that. A photographer from the hospital shot the entire thing and gave the video to us and actually to me. So I actually own that video. I don't have to worry about it popping up somewhere. Or NBC owns it, but I have the only copy. And, they allowed us to do what we felt was best to try to get the story out there and to get people interested. And it really worked. I think my managers were surprised after the first couple of days, and the interest was huge. And so they were scrambling to come up with more stories and to follow up and to get pictures of me, in the wheelchair on my way home or whatever. So people were very interested. And on Facebook, I started a new Facebook page just to tell people how I was doing, and people were truly interested. I was surprised. They were really interested, and they really were passionate about sending their good wishes.
So why do you think people were so interested? What element of the story do you think appealed to them?
I think it was the sense of this is something that could happen to any of us, and I really believe that was a lot of it. I had a lot of messages from people who either had family members who had kidney disease or died of kidney disease. I heard from a lot of donors who said, thank you for showing people that this can be done. I heard from African Americans and African American donors who said, thank you so much for bringing this to the public's attention, because a lot of African Americans don't want to do this. And I think it's great that you're stepping forward and showing that you can do this and this is why. And there was that entire element also of the mother, daughter, and the daughter helping the mother. People really connected to that and just our love for each other. But I think there was something about it that was just, hey, this is happening. This can happen to anyone. And I do think people learned a lot about kidney disease from watching the series. And I think people learned how diabetes is connected as well. And I did hear people say that. They had no idea that there was a connection. So those were among the comments I got.
So when did you first learn of that connection between particularly diabetes and kidney disease, but also with hypertension and obesity?
I'm a little embarrassed to say that even though I've done stories about all kinds of illnesses, I can tell you that I really don't think I made that connection between kidney disease and obesity. I may not have made that connection until recent years. When my mother told me she had kidney disease, I, of course, went and looked up as much as I could about it, and I learned those things. But I didn't realize how prevalent kidney disease is. Again, I learned about that connection between obesity and kidney disease and the need for a transplant. I mean, folks don't really know that obesity might mean you'll have a kidney transplant. You'll need a kidney transplant. And I think if they did, they realize all you have to do is lose some weight, change your diet, and I can avoid that. Perhaps more people would make more of an effort.
You'd mentioned your family history and the fact that kidney disease wasn't discussed in the family, and thinking of other disease states like cancer or cardiovascular disease, where it seems like families will have that discussion. Do you think it's something unique to your family that you didn't discuss kidney disease, or is there a broader societal issue that for whatever reason this disease doesn't get discussed among families, in the community in general?
It's a bigger issue. I don't think it's a taboo issue. I just think that people don't really get it. And I think part of the problem there seems to lie with doctors, perhaps with primary care physicians not really explaining this to people. I think we've all had a doctor at some point, one of those who comes in, stands up for 10 minutes the entire time you're there, takes some blood, and leaves, and that's the extent of your relationship with them. But I think we really have to talk about this more, and I think that first doctors have to really explain to people, I'm telling you to lose weight, but this is why. These are the things that can happen to you. It's not just you need to be skinny. It's that it could lead to this, and that. And I think when people get to the point where they are diagnosed with kidney disease, they need to be encouraged to discuss it with their families. It's not a negative. And I do think culturally perhaps some groups are more secretive about with their family members about their medical issues. I don't know, but I know that in my family, my mother never talked to us about her illnesses other than those things she thought we really had to know. So, she had diabetes for 20 years. I didn't know that. I'm 40 now, so for most of my adult life, she has had diabetes, and I did not know that for most of that time. She didn't discuss how it affected her life or, what could happen. So the bottom line is we have to talk more about it. We need to figure out a way to launch a public education campaign. If we can do it with breast cancer, and if we can do it with things like smoking even. Anti-smoking PSAs are everywhere, and they actually work. So why can't we do it with something like kidney disease? It's just a matter of getting people to understand the effect it could possibly have on their lives. And people don't know that the decisions they make when they're putting food in their mouths could affect their families as well, because you might put your family in a situation where they have to decide whether or not to give you an organ.
So it sounds like there's perhaps two public awareness campaigns that need to occur. One would be with health professionals, particularly primary care physicians, where they're more conscious of kidney disease, but also the risk factors. Mm-hmm. And then the second one is with the public in general, akin to the breast cancer campaigns, where there's just more awareness of the disease, the prevalence of the disease, the risk factors, what individuals should take, how they should address it. Which of those two, if you had to prioritize them, how would you prioritize the two?
Doctors have to help their patients develop a better understanding of kidney disease and its causes and its consequences. But I do believe a public campaign for everyone else is very important. People just don't know what kidney disease is. They really don't. They don't know what it is. While we're talking about obesity, because everybody's talking about it right now, the obesity epidemic, this is a prime time to explore, to explain what that really means and, the bottom line, and just the bottom line. I do think people now know that obesity leads to diabetes, and maybe they know it leads to high blood pressure, but they just think that means I'm going to have to start taking pills. That's really what people think. Oh, I'm going to have to start taking pills, and that's it. And they don't think beyond that at all, and I can tell you that because everyone in my family has high blood pressure, and I think one of my sisters, I think, has high blood pressure and diabetes. So I can tell you that for a fact, that they all it's just a matter of, I've got to take pills, and that's all. There's no thought beyond that.
And I guess that's one of the issues with kidney disease is while there are some medications, really what most people think about is dialysis. And I guess we've talked a little bit about transplant. If we move earlier in the process, what was your reaction to your mother's dialysis?
It was very sad for me. It was sad I was sad for her that she had to do that. However, at the time that she started it, her health was so bad she could barely walk. And I don't know specifically what the problem was. She had anemia. She was very weak. So in the short term, the dialysis really changed her life. She had more energy. She looked better. She was back up walking around. But, I know now that dialysis can ruin a person's life. It can bring it to a halt. And I also know that it's not a cure. I don't think I thought of it that way before my mom was on it. I think a lot of people think that it is a cure. So when she started, immediately she looked great. It was better. But then she's going to dialysis 3 times a week. She had frequent infections, and the stents were clogged, and the fistula had to be redone. It seems like once a month. So she just had so many problems. My fear became that she was going to die of an infection before she could even get a transplant if we waited for her to get a cadaver kidney. So my fear was just for her and how uncomfortable it was. And there was a period, I think in March, where she was in the hospital maybe 4 times, and each time she had some type of surgery. And it was all because of dialysis. So I was very sad for her, and it became very painful for me to watch. And I really wanted to get everything underway. And, it was last spring where I thought, I can't put this off any longer. I have to do it. I'm ready. And it was because of watching her and of seeing what was happening to her on dialysis.
She's had the transplant. How is she doing now?
She's doing well. I spoke to her this morning, and her numbers are well. She has to go back to the hospital 3 days a week. They are still tweaking her medications, but the only complaint she has right now is that she does have some back pain, some muscular back pain. But that's it, and she's still very tired, as I am. I'm surprised by that. I still have a problem with fatigue. At the end of the day, I just am wiped out, and I didn't expect that. Because I was in very good health before the transplant. And I thought I would bounce back very quickly, but I'm hearing that, it could take months, which is fine, but that was something that nobody explained to me before.
So we're sort of back to where we started in the sense that one of the key recommendations that you would have would be to provide as much information as possible throughout the process to people who are donating organs.
From the very beginning.
Yeah.
From the very beginning, just resources, who they should call, where they should go. And I really don't think these, transplant coordinators are equipped to do that. I'm sure most of them are very nice people, but obviously they can't sit on the phone with me every day and listen to my questions. And I just think there should be more. I got packets of information, that type of thing, but that's not the same thing. It really isn't. It doesn't give you the kind of information you need. There was a point where I just needed to make a decision, and I just needed to know something. I needed to talk to a doctor to tell me that if I did this, my mother would live X number of years more. And I realized that they can't answer that, but I just needed to talk to someone about the stats and based on her profile, what would the outcomes be? I never had that. And I finally just had to go through channels of people I knew to talk to someone. But, and actually one story I would like to get in here. I did find a doctor, a friend of a friend, who I got on the phone with her. She called me really late one night, and the first thing she said to me was, "You shouldn't do it. Don't do it." And I said, "What? What do you mean?" "Don't do it. You have doubt. Don't do it." Which to me was a little insane, because basically she's saying anyone who has any doubts or questions should never do it, and that's insane. Everyone's going to have questions and concerns. And this woman said that the entire conversation. And it actually, the next morning I woke up and I thought, what is going on? I'm doing it. And I went and got everything in order. But, the fact that the only thing she could say to me was, "You have doubt, don't do it." And apparently they say this to people all the time. And of course you're going to have doubts. It doesn't mean you don't do it. It just means you have questions. And someone should be willing to answer those questions and help you make an informed opinion. And if you step out, that's fine. I understand that they are afraid people will feel coerced, and they don't want people to get to the day before and change their minds. But at the same time, conversations like that are so frustrating. They don't really help. And I also, it seems as though every time I spoke to someone, I just kept hearing the death risk, which I get that. They kept saying, you could die. and I get it. I understand that. But tell me something else.
Well, in my sense is there's probably not a likelihood that people aren't going to pursue pregnancies because of the potential death risk.
Exactly. And I know that there's a risk of death. I get that, and I understand that they want you to be clear. But basically, along the entire process, people were trying to talk me out of it. Anyone I actually got on the phone, this was towards the end especially, people kept trying to talk me out of it. And I told one doctor, stop saying that. I have made my decision. I understand that there may be people who are afraid. I'm not one of those people. Look, I'm here. I'm excited.
It's not surprising that there are so few kidney donors. I mean, I think our statistics are that there are, fewer than 500 people donated kidneys in Texas, even though there's, 18,000 people on a waiting list for a transplant. So, there's this clear informational issue. It sounds like there's this fear of coercing potential donors. Are there other sort of concrete things that the community needs to address to increase the level of donation?
One of the things that in the note that you sent me, you asked me about African Americans. And I would like to say that as far as African Americans are concerned, I do think part of the public education campaign could include churches. There are many communities across the country with very strong African American communities with very strong ties to the church. And, churches should be involved in education campaigns. I know a woman here who's a kidney transplant recipient who's gotten very involved in the education campaigns at her church, and she's helped develop support groups for families there. And so this is a very large church. It's a mega church. But those types of things could be implemented elsewhere to help people just learn more about it. Even pastors can learn to counsel people who are thinking about being donors. That's what I didn't have. I didn't have anyone to counsel me.
It sounds like using donors like yourself and recipients like your mom as potential spokespeople working through local churches and local communities could be really effective.
I really think it can be. We've had a few stories done in local papers and online publications here locally, and we've gotten a lot of response. And, one paper called me, and it's a paper that normally prints religious news and things like that. They called me and said they'd gotten calls from people saying, thank you for putting this kind of information in the paper. And my mom, I think, is very eager to go share her experience, and she's not a person who I would ever have thought would do something like that, but she believes strongly in it as well. And she says that she did not really know how long she had kidney disease, and even though she went to doctors every month for years because of her diabetes and high blood pressure, but she says she didn't really understand it, or it was never made clear to her that those issues would lead to kidney disease, or that kidney disease was in her near future. So I think she wants to help people learn as well because of her experience with that and just sort of being in the dark.
And I really appreciate both your advocacy on behalf of people with kidney disease, but also encouraging people to consider transplantation and donating for transplantation, as well as for taking the time to talk with us today. And I just wish you and your mother, the best, and I hope that both of you continue to do well.
Well, thank you. I think we will be just fine.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. The information in this podcast should not be used during a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.